Hello, this is Governor Ron De Santis. This month has brought promising news regarding therapeutics and vaccines to combat COVID-19. And the state of Florida has been working to procure the new treatment for our hospitals. We've also made plans to assist in the distribution of a safe and effective vaccine, which we believe will be delivered relatively soon. I've also been able to meet with key officials involved in Operation Warp Speed in Washington, and have been able to get key questions answered for the state of Florida. Now, I know there's been a lot of discussion about the vaccines, and rightfully so, it's important, but I think the new therapeutic that was developed by Eli Lilly and is approved for emergency use by the FDA is also very significant. The treatment is a monoclonal antibody cocktail. It's administered through an IV. It takes about an hour for the IV to be administered and then an hour to observe the patient afterwards. It's best used for people who are at high risk of severe complications from COVID-19. And the key is to deliver the IV as soon in the infection as possible. So this will be people who maybe show up to an emergency room, are developing symptoms, but are not yet at a critical state where they would be, say, in an intensive care unit. Now, data from clinical trials found a 70% reduction in hospitalized patients who utilized this treatment. We also know that a similar cocktail is being developed by the company REGENERON. That is currently pending before the FDA for emergency use authorization. We think that that may also come in the relatively near future, and of course, that would also mean more supply of this particular treatment for folks. Now, we surveyed all hospitals in Florida to determine demand. We sent that information to the federal government, and the Health and Human Services Department used that information and have now sent over 3,000 doses of the treatment directly to hospitals. And this has arrived just within the last few days, and they plan on sending a similar amount every week for the foreseeable future. I've spoken with a number of hospital CEOs, and I'm pleased to report that many have already received the treatment and are moving forward administering the treatment. And we're going to continue to work with hospitals and other providers to ensure that qualifying individuals have access to this treatment. Now, the vaccine news has been particularly heartening that's come out in the last couple weeks. Since July, we in the state of Florida have been actively planning and preparing for vaccine distribution, including by purchasing necessary supplies. To date, we have purchased 5 million syringes, 5 million needles, and 5 million alcohol swabs. Now, both Pfizer and Moderna have reported vaccines with 95% effectiveness. Those will, hopefully within the next few weeks, receive FDA approval. The Pfizer vaccine is one that needs to be stored in -70-degree temperatures. The state of Florida has identified 5 different hospital systems who have the ability to store the vaccine at those temperatures and administer that to the qualifying individuals. The Moderna vaccine can be used in normal refrigeration and does not require those extreme low temperatures, so that will potentially provide more flexibility. Right now, the best estimate that the federal government has is that by the end of December, pending FDA approval, there will be roughly 40 million doses of these two vaccines available, 25 million for Pfizer and 15 million for Moderna. Each individual requires 2 doses, so that would mean there would be enough vaccine for 20 million Americans by the end of December. And the good thing about this is millions of doses are ready to ship as we speak. As soon as the FDA approves, they will then go out within the next 24 hours, and we expect our hospitals, hopefully, to receive these within the next 3 to 6 weeks. It's all contingent on when the FDA approves. Now, shortly thereafter, or maybe even at the same time that hospitals are receiving the vaccine, both CVS and WALGREENS will also begin receiving vaccine to administer to residents of long-term care facilities who, of course, are most vulnerable citizens when it comes to COVID-19. So far, nearly 2,000 long-term care facilities have registered so that they can start getting their residents vaccinated as soon as the vaccine arrives. Now, as we move forward, my administration is going to continue to work hand in hand with our federal partners, and we provide you updates as soon as we have them. In fact, I was just in Washington, D.C. meeting with the Secretary of HHS, the Director of the CDC, to ensure that the state of Florida is fully prepared to distribute the vaccine as quickly and efficiently as possible. Our goal is to make all safe and effective COVID vaccines available to Floridians who want them, but the state will not mandate that Floridians take these vaccines. That's going to be the choice of each and every Floridian. I do, though, believe that these breakthroughs represent probably the greatest rays of hope that we have seen since the pandemic began. They offer the prospect of saving thousands and thousands of lives and to potentially bring this pandemic to an end. Thank you all for all you've been doing. I know it's been tough. We're going to keep working hard to support everyone, and God bless you all.